most popular gifts during the holidays is a brand new bike for children and adults. Unfortunately, cycling can be dangerous and can cause injuries. Dr. Mark Schweppe from Novant Health Orthopedics and Sports Medicine is with us today to discuss cycling injuries and how to prevent them. Good to see you. Thank you so much for joining us.
Thanks for having me.
All right, so now what are the most common cycling injuries that you see?
Most commonly we see hip and knee injuries in cyclists. Additionally, cyclists frequently complain of neck and low back pain, as well as numbness and tingling in the arms and the hands, and this can be related to poor posture and poor technique while riding.
And so are those the potential causes or contributing factors to some of these injuries?
Yeah, one of the primary causes to these type of injuries is equipment that fits inappropriately, such as a bike frame that's too large or too small. Additionally, poor technique while riding can also attribute to these injuries, but primarily the inappropriately fitting equipment.
All right, can you go in more detail about the knee injuries that you see in cyclists?
Sure. Knee injuries are very common. Most often they are related to overuse, which can in turn cause tendinitis or inflammation that I'm sure many folks have heard of. Generally, these symptoms get better with an appropriate period of rest, as well as with over-the-counter oral anti-inflammatories such as Advil or Aleve. And that's the most common knee issue that we see.
Okay, so when should people come see an ortho like you?
That's a great question. We're obviously happy to see any athlete, cyclist or otherwise, but certainly in cycling, injuries that do not get better with time should be evaluated, or what we call mechanical symptoms. Those are symptoms such as locking and popping and clicking within a joint. If they don't get better, then they should be evaluated. And then, of course, anytime there's a bicycle crash or a traumatic injury, they should be evaluated.
What can we do on the prevention side?
Prevention is key, and in order to prevent injury, as I previously mentioned, it's very important to have equipment that fits appropriately. And some key points are having the seat the appropriate height, having a frame that's the correct size, and then having the handlebars and the pedals positioned appropriately. Those are the primary ways to prevent injuries while cycling.
All right, going to have to make that the last word, but thank you so much. We do appreciate it.
Thanks for having me.